So no one's going to doubt that as teams get bigger and more complex, that the main concern about organising this large team is getting the rotas correct. Got a fantastic message from Dr. Sarah Videlo from PracticeBuddy that she's got a solution, probably saved our admin team around 50% of their work as they're coordinating.
PracticeBuddy came from, I'm a GP partner in a partner in Northamptonshire. We are a big practice, 27,000 patients.
Oh, wow. Okay.
And so, it came from a need of how do we make this a bit more simple? We were relying on Excel spreadsheets, which, inherently have their risks of they break. Just thought there needed to be a better way of doing this. More than that, though, there was, it came from actually, it's not even just about managing the rota now, it's about managing appointments and trying to, make sure that you've got the right number of same day, the right number of your routine appointments,
So I was going to say, do you want to show us it?
This is just our sort of test rota, but it gives you an idea as to what it looks like. So it's personalised to your practice. So your practice name is at the top. This would be your practice logo. You can change the colour schemes and everything that you want to kind of personalise it to you. And this is your dashboard. So this is the view you get when you first log in. You can see here it links to your rota and your room rota here. It has a list of targets set up here, and I will come back to that in a minute, but that's just where you view all of those things, and these are all related to your targets. So if we start off by going into view rota, so you bring up essentially, like I said, this has its origins in an Excel spreadsheet, so it kind of looks a little bit like an Excel spreadsheet. But you can see on here down the side, these are all your roles. So these are all the different clinicians that you might have, and each staff member has a row on the rota, and it gives you a week view. As you can see, this one's set up to do evenings and Saturdays, but if you don't work evenings or Saturdays, you take them out, they wouldn't appear. So it's fully customizable to your shifts and the way that you work. In terms then of, how you change the surgery. So everyone has a default rota sort of set up in the practice. When you put that member of staff on there on their profile, they have a default working pattern that's loaded into the system, and that's what will appear automatically. And then if you want to change them, make them duty doctor or whatever, then you would just click on that cell and then you choose from a drop down list here of what that thing might be. You can see that sitting behind these things are appointments. So it knows that with a surgery that there are these types of appointments sitting behind it. So follow-up appointments, same days and routines, you give it that information. So essentially each of these, we call them activities. So each of these activities here should be something that matches like a template on your system on Remus or something that you put onto the rota. So it would match the information that you're putting up onto the rota.
Depending on who we're debriefing, it will be generally the last one or the last two appointments of the session will be blocked for debrief whoever. So think registrar, medical student. And what we find then is that then doesn't overwork the doctor, and it works two ways. So the registrar, for example, knows who exactly to go to for a debrief, and then likewise the doctor knows that they are debriefing, and more importantly, they've got time to do it. And this captures this quite nicely.
And we do that. So so if on here, for example, you wanted this person to be debriefing, you can add another type, and we can add a block. So we do that. So we would put one block in. You then would reduce, say, for example, your number of your same day appointments to account for that. And then you might just put a note in here saying debrief.
Yep. Brilliant.
Dr. Y. And therefore that will then kind of put a note on the rota that they know that they're doing that exactly as you say. So you can't assign somebody something that they don't do. So the activities are individualised to that staff member. So you can't put somebody in doing a minor ops clinic who's not trained to do minor ops, for example. With your nurses, you can't put them in for a smear clinic if they're not trained. So you tell it all the particular skills that person has and what they can and can't do. So you can't make a mistake on the rota. And things like if you have so for example here one of the nurses does a shorter afternoon, you set up a specific shorter clinic for them but that's only on them, so you can't accidentally allocate that to somebody else as well. So it's sort of a bit safe, foolproof from that point of view of making sure that you're not getting people doing things they can't do. One of the reasons for having the appointments in there is that it will do some allocating of appointments for you. So if I click on show targets at the top here, you can see that here there are targets set for the number of same day appointments that you want to have available that day.
Yep.
Or in this case, in the afternoon, and the number of routine appointments that you might want that week. Now, this is not a fully occupied rota, so those obviously it looks like we've got quite a healthy number of appointments, but this is just to demonstrate the automation here. So you can see that on this day, for example, we wanted to have 30 same day appointments in the afternoon, but at the moment, because of what we've selected there, there's only 17. So it's highlighted up as red. On this day, we've actually got too many same day appointments. So it's come up as this pale green. So it's saying that you're fine, but you're not being as efficient as you could be. And again, it's highlighting up as red here. If we then go to Open Adjustment Helper, and then we come down to the bottom here and click Run Auto Adjustment Now, it essentially has now taken all those appointments, shifted them around and made them meet your targets.
Oh, wow.
And it's essentially taken them from same day and dumped them all into routine. So when you come back to the rota and go back to your targets, you can see that now this is all green, so we've met exactly our same day target. It's stolen those or given them to routine as required. So if you were doing something like you had, you wanted to have some 2 or 3 day routine appointments in there, you could put that in there and allow PracticeBuddy to automate it, and it would always make sure that you have some same days, some 2 to 3 day routines, and then your routines at the end. So, and it generates a report and tells you what each person is doing, and how to then put that onto the rota. So it doesn't talk with System 1 or EMS, but it generates a report to allow your rota coordinator to put it onto your appointment system.
And I think even that, it's just a sort of like, I suppose that's maybe a downside, but sort of like, but on the reverse, you could argue it's got a set printout. If someone followed it of like, right, you need to generate clinic for this, this and this, then it could be anyone, not just your rota coordinator that's doing it, or someone that, a well-trained member of staff. Given that spaces, and I'm not going to have a rant about properties and NHS properties, but everyone knows there's frustrations. How does that fit in? Because it was a new feature to me, and I was a bit like, "Oh, that's quite exciting."
Yeah. Okay. Well, yeah, I'll show you. So essentially, what it does is it knows. So you tell it which of your staff have a set room, and you also tell it which of your activities need a room. So if you're doing a remote surgery, for example, you don't need a room, so it will know that. Or if you do your duty from a different room, or whatever it might be doing. So once it knows all that information, essentially all you do is you go back to the dashboard and click on room allocations. So I'll go to a week. This week's been done, but if we go to a week where here, so this is what it would look like. So it'd take a brand new week and say, okay, well, based on the data I know, I've automatically allocated these people to their usual rooms because they're doing surgeries and they need a room for it. If you're happy that looks broadly right, then you can click confirm default allocations and it turns it all to black for you.
Nice.
Then you can see here, it's still saying check. So if you click on that, you can see, well, actually, I've still got these 4 people that don't have a room allocated.
Okay.
So I can just click on, down the list, allocate them to a room, and then you can see it's happy that I've allocated everybody. It's gone green. I know that everybody that day or that morning has got a room allocated. And then once I'm happy that I've done that, I can just click on this little icon here, and it will print me essentially a form that you can then put up in your office or wherever it might be, so that people can come in that day and see what room they're in.
Oh, that's clever. So you could put that, say, on your notice board or something like. Oh, that's just genius. That's why I love this software, because it's like, yes, thank you.
Yes, essentially we call them. These are all targets, and they can be done in different ways. And you can use them to various different things. Like, for example, it could be if you really wanted to keep track of this doctor's done this X number of duty sessions in a year, you can track it to that degree of, I guess it depends on your individual wants and things. But the main way that we use it is for essentially setting up appointment targets. So I would give an example of LD reviews. We have a certain number that we need to do over the year to reach our target. And so you can tell PracticeBuddy then, therefore, I need to do X number of reviews in the next 12 months to reach that target. And it will track on this. It will say, okay, well, this is the line we should be following if you're going to be doing it over the year. By the end of this date, you want to be at this target. It will then look at what you're putting on the rota. So it's like, okay, well, from what you've allocated, actually, you're not, so you can see here we were quite behind where we needed to be.
Yep.
So then it just tells you, okay, well, you need to make a big push now to then get to where you need to be. So it's essentially just a way of tracking and monitoring your progress against the target to see whether or not are you likely to be able to meet. And if you're not, then you need to do something about it, essentially, rather than waiting till the end of the year and then being like, oh, we need to quickly.
Yeah, and I think actually that's where something like this coming in at this time of year, we're at the beginning of the QOF year. Like, actually, if you got this on board, adjusted your systems, tracked it all out, you could make the correct number of clinics spread throughout the year so that that you're not having a mad rush in March, April, February, March, just to try and get them done for April, which, is the pain of every partner, unfortunately, or every practice, sorry.
I think the other thing just to talk about would be the calendar link.
Of course, yes.
So we talked about that. Obviously, you can log in. So because this is it's not an app, it's a website, so you don't need to have any, software installed on your phone or anything. You can access it from whenever you are. Your staff can then log in from home or wherever and look at it. But the other way of doing it is to have a calendar link. So essentially, each individual member of staff has their own personalised link here for their own calendar, and they can take this and integrate it into their own. So their Outlook. So it works with Outlook, it works with Apple, it works with Google. So you with your own personal calendar. And you can change. So this looks 4 weeks ahead at the moment. So it will automatically then upload that individual person's rota onto their calendar for the next 4 weeks. It checks every few hours. So if you make a change, or if your rota coordinator makes a change to that, within a few hours, it's updated on your calendar so that you know that the changes have been made.
Got Julie, who's our phenomenal rota coordinator, who I've talked a lot about, who I've bullied into being on the video. So we've got to be nice. We're going to flick over to our Eaglescliffe Medical Practice PracticeBuddy, and she's going to talk us through what we've used. You'll see already on the front page that we've not used half the tools that we've talked about with Sarah earlier. So go on, Julie, talk us through it.
Okie doke. So first of all, just about PracticeBuddy onboarding guide that we got through. I thought I'd mention that because it was so easy to follow, user friendly, and it's like a Bible. Literally everything you would need to know about PracticeBuddy is in here. So this is what we used to build ours in the first place. Just to give you an idea of how we've used it and what we've utilised on it. Basically, the settings section, you have team members, roles, things like that. Our roles have all been defined as to exactly who we have in the building at the time. We have all of our students on there as well, which we don't have all the time, but it's really handy to know when they're due to come in if we need covering things for them as well. And then we also have our, under settings again, actual team members.
Near the top. Yes.
Yes. So you can order that in any way you like. So we've got it in order of seniority of partnership. And in here as well, you can also add in the annual leave, which is a really, really handy tool. So we've utilised that part as well. And I've also used it for anything that's coming up like meetings or training or anything like that. So it populates it into our actual rota. I'm going to go on to show you the actual rota because that is where everything sits.
Brilliant.
And if we just go back to one of our weeks that we're using at the moment. So this is, for example, the bank holiday week we've just put on at the back end of May. And as you can see, we've defined some slot types for ourselves that have duty doctrine things on them.
Okay.
So then at a glance, you can see that who's duty on that day. And we've also utilised the adding notes function. So you can hover over the question marks on the screen and it'll tell you what you're doing that day.
Brilliant.
So if you've got to cover GP regs, students, anything else, it's all there in one place. I find this really useful because this was all recorded previously in about 5 different places.
Yeah, I counted. Go on. So I got the wall calendar.
Wall calendar, my calendar.
Yep.
Angela's shared calendar. System 1, holidays, annual leave.
Right. Okay.
And we also had in a folder, so paper copies of requests, holidays, front sheets, everything was all there together. So all of that has now been condensed into this one program, which is fantastic for me. It saved a lot of time.
I was going to say, I joke, sort of semi-tongue-in-cheek, said like about 50% of your time.
Yeah, I would say so, yeah. I think there's a bit of setup work to go into it, but once you've done that, you can populate it as far as you like. So that's what I like about it, is I've put in the annual leave for the whole year, and we can then look ahead and see where the problem days are in October if we need to. So for a planning perspective, you can decide when you need locums, when you need someone to swap a shift, anything like that, so far in advance now. You know, the problems are there before you even can think of them. You know, it's all...
And that's it. Like, jumping back to locums, they soon get booked up.
Yeah.
So our locum that we regularly go to, she's incredibly popular because she's very good.
Yeah.
So we need to get her on board early. So because I think that's what was great, that, you know, from our discussions, that we've only sort of scratched the surface of it, but it saves so much time.
Yeah, absolutely.
And sort of like, as I sort of mentioned earlier in the video, Julie's one of our senior admin people, so she has a bucket load of work.
Yeah.
But heavy work to do that's more important than just the rota, even though that's, as we've discussed, that's hugely important. Fantastic. Well, so leaves me to say, once again, a huge thank you, genuine thank you. You've really helped out a member of our team. What is the best way, if people are curious, what's the best way to get in touch? Okay, so I go to our website, so it's PracticeBuddy.uk. Bring it up on here. So yeah, PracticeBuddy UK. hello@PracticeBuddy.uk. Email that. You can contact us here, and you can just send a message directly on the website as well, and I will get in touch with you. Fantastic. Well, that's it. And please get in contact with it and save your admin team a load of work. Brilliant. Thank you, Sarah, for your time. Thank you. Cheers.